Hello and welcome to the Awareness Program. I am Dr. Kazi Suhail and I'm a gastroenterologist working at GMC Srinagar. My motto is to create awareness, and today I will be discussing about colorectal cancer. I get a lot of questions during interaction with my patients. In this video, I will try my best to sum up most of them. So what exactly is colorectal cancer? Colorectal cancer is a cancer that begins in the large intestine or rectum, which is the last part of our digestive tract. It often starts as a small, non-cancerous polyp that over time may become cancerous if not detected or removed early. In many cases, it starts silently, no pain, no symptoms, and that's why it's dangerous. Now the question is this a big issue here in the valley? Are people really aware of it? The answer is big no. Unfortunately, in Kashmir, the number of cases is rising and more young people, even those in their 30s and 40s, are being diagnosed. A study at SKIMS showed that over a good percentage of colorectal cancer patients were below 50 years, and that's very concerning. We often don't talk about bowel health due to stigma, and late diagnosis leads to poor outcomes. Another question is what is causing this? Why is colorectal cancer increasing in Kashmir? I would say it's a mix of lifestyle, diet, and environment. But here in Kashmir, some very specific cultural factors are playing role, like smoked and pickled foods. It's not just Vazwan, also smoked fish, dried vegetables, and traditional pickles. These contain nitrates and nitrites, which convert into nitrosamines inside the gut. These are proven carcinogens. They damage the DNA of colon cells and can initiate cancer. In studies, there is a clear link between nitrosamine-rich foods and increased colorectal cancer risk. Number two is noon chai. Our traditional pink tea is rich in sodium bicarbonate and salt, which we consume several times a day. High sodium content can cause chronic inflammation of the colon lining and can alter gut microbiota, both of which can promote carcinogenesis, that is, cancer formation. Studies across the world also recognize salt intake as a probable cause of both stomach and colon cancer. Number three is sedentary lifestyle. Kashmir's long and cold winters often mean the little physical activity. Add to this low fiber diet and you have sluggish bowel movements. Longer exposure of colon lining to toxins increase the risk of polyp formation and eventually colorectal cancer formation, which has been seen up to 35% with these two factors. Number four is smoking. While smoking is a well-known risk factor, I would say chronic exposure to heat and coal in winters may also contribute indirectly to digestive tract inflammation and systemic carcinogenic exposure. Though it is more linked to skin cancer, chronic exposure to polyaromatic hydrocarbons may play a role in gastrointestinal carcinogenesis too. Another question is, can we prevent colorectal cancer? Yes, this is the best part. Colorectal cancer is one of the most preventable cancers. You need to increase fiber intake. Fiber bulks up stool and speeds up bowel transit, reducing exposure to toxins. You can take fresh vegetables, especially leafy greens, fruits like pears, berries, whole grains like oats, brown rice. There are certain foods that naturally block inflammation and carcinogenesis like garlic, turmeric, walnuts, almonds. They contain antioxidants. Now, there's a role of vitamin D and aspirin also. They should be given under medical guidance. Vitamin D improves immune surveillance in the colon, and low-dose aspirin reduces polyp formation and inflammation. Exercise and weight control, even 30 minutes of walking daily improves gut motility. It reduces insulin resistance and helps lower inflammation. And last but important is screening. Screening is key. If you are above 45 years, have positive family history of colorectal cancer or polyps or any of the symptoms which I will discuss, you should consult doctor for colonoscopy or stool test. It could save your life. Now, what are the symptoms people should never ignore? And it's very important. These are called red flag symptoms, and these should never be ignored. Bleeding from the rectum or blood in the stool even once, unexplained weight loss, persistent abdominal pain or bloating, change in bowel habits, alternating constipation and diarrhea, feeling of incomplete evacuation, fatigue and anemia without a reason. Even if these symptoms are mild, they could be an early sign of colorectal cancer or polyps. Another question is, who should go for a screening colonoscopy? The answer is anyone above 45 years, even without symptoms, should undergo screening colonoscopy. Also, anyone with a family history of colorectal cancer or polyps, those with inflammatory bowel disease, people with genetic syndromes like Lynch syndrome, those with high risk lifestyle factors like smoking, low fiber, red meat, obesity. Another question I get many a times, if I have no symptoms at all, should I still go for colonoscopy? And the answer is yes, absolutely. If you are above 45 years, that is the whole point of screening, to catch polyps before they turn into cancer. Colorectal cancer grows very slowly. It takes 8 to 10 years for a polyp to become cancer. If we remove it early, we can prevent cancer altogether. I would like to clear a few myths. Colonoscopy is not dangerous, and most of the times it is not painful. But some patients, especially obese, or those patients who had undergone some abdominal surgery in the past, may feel discomfort during the procedure while negotiating the camera. With modern equipment and trained specialists, colonoscopy is safe, smooth, and effective. You may feel slight cramping, but it is minor and temporary. Complications are extremely rare, less than 0.1%, and the benefits far outweigh any risk. The test takes only 15 to 20 minutes, and it can literally save your life. Another question is, if someone gets a colonoscopy at the right time, how effective is it in preventing colorectal cancer? The answer is yes, it is absolutely effective. If done at the right time, colonoscopy is almost a miracle tool. It can detect precancerous polyps. It allows us to remove them immediately. It gives a clear view of entire colon. Another question is, how often should one repeat colonoscopy? If your colonoscopy is normal and you are low risk, you may not need to repeat it for 10 years. But if polyps are found or you are high risk, the next colonoscopy may be due in 3 to 5 years based on what we find. Almost always follow your doctor's advice. In the end, my final message is colorectal cancer is real, it is rising, and it is preventable. Don't ignore your gut. Don't be ashamed of discussing symptoms. Add fiber. Cut down your smoked meats. Get screened, even if you feel healthy. And most importantly, talk to your doctor. Your health is your strength. Let's protect our families and our future together. Thank you and see you in the next video.